Hi there, everybody. I'm Dr. Evan Lewis, and today I'm going to be running through a presentation on psychedelics and ketamine therapy, how they work and how they're used. And this session is aimed particularly at the general public. We're going to cover a broad range of topics, and my goal here is to really break these things down and try to create some kind of semblance of a model that's palatable for the general public from people coming from all different areas and backgrounds of education and knowledge and experience. So let's get started. This is a series of presentations, and the first one today being an introduction to psychedelics. The subsequent presentations are going to look at the mechanisms that underlie psychedelics and then some of the conditions in neurology which psychedelics potentially can be used, such as functional neurological disorders and concussion and brain injury. So if you like this one, stay tuned to the channel, and I'll have those subsequent two talks posted when we get them completed. For today, we're going to explore certain questions like what psychedelics are, what exactly psychedelic-assisted therapy, what are the uses, the evidence, what treatments are available, and also as well how psychedelics are used in neurology. That kind of brings me forward to kind of who I am, so everybody out there can have a sense of where this information is coming from. I'm a trained pediatric neurologist and epilepsy specialist and found my way into psychedelics through a lot of the work I did in cannabis medicine in pediatric epilepsy. I am the director of the Neurology Center of Toronto by Numinous, which is located in Toronto, in Midtown Toronto. I'm also a VP Psychedelic Neurology in Numinous and work as a Chief Medical Advisor for the JMCC, which is a medical cannabis company, and also hold some various other positions, such as Assistant Professor at the University of Toronto. So this is very much coming from a neurologist's viewpoint, as I have a keen interest in psychedelics and how we can apply psychedelics in the context of neurological disease and neurological conditions. Okay, so moving forward, why psychedelics and why are we talking about this now? What is it about psychedelics right now that just seem to kind of be everywhere in our media and our social media feeds, movies and TV shows? Well, seems to be that we're in the midst of this psychedelic renaissance right now. There's just this explosion of research that's happening in the academic space. And it seems to be that psychedelics are an emerging treatment for a lot of mental health conditions. And there is this potential for treatment to be utilized in other conditions. And the other key thing that's really interesting from a neurologist's point of view is that psychedelics seem to be giving interesting insights into how our brains work and how our brains process our environment, and also some interesting interesting window into consciousness and how consciousness evolves and is created. So there really is a lot of potential on the psychedelic side to snake into some other areas that might be outside of what we hear generally in terms of the mental health arena. And really, there seems to be a lot of hype out there. There's a lot of claims and a lot of promise. And I always think about that and think like, well, why now? Why is all this hype and, and all this information about psychedelics out there? This is a favorite statue of mine in the Royal Ontario Museum. And this is a statue of a bodhisattva. A bodhisattva is someone who has great knowledge and wisdom and is capable of achieving Buddhahood, but decides to stay on Earth to share the knowledge with others. And this statue struck me when I found it some years ago in the museum, because clearly this is an important statue of an important individual. And the statue has around it 12 important figures or animals. And interestingly, one of those is a deer with a mushroom of immortality. So I'll let you kind of think what that implies, but this dates back to the 14th, 15th century. And so mushrooms seem to be prominent back then. Mushrooms and other psychedelic substances were also prominent in the 50s and the 60s. So, some of the things we're seeing in popular magazines now and popular media talking about certain individuals in the public sphere who are undergoing these radical psychedelic experiences that are changing their lives. Well, there you have Cary Grant, a famous movie star, back in 1959, describing his psychedelic experience. So the hype is maybe appears like it came out of nowhere, but this has happened before. And so that's why it's important to kind of go through a bit of a journey of the history of psychedelics. So let me take you through that. So really busy kind of timeline here. You can pause and read through all of this. I'm going to kind of highlight big segments here, okay? So we have prehistory. In prehistory, we've got a lot of evidence that talks about human use of psychedelics. We have peyote buttons that date back to 3700 BCE. We've got a lot of discussion about the ancient Greeks utilizing psychedelics. A really interesting book called The Immortality Key, which you can look at by Brian Mariscu, that goes into some of the details about ancient human use of psychedelics. Moving forward, you have the early modern era where we have documentation and descriptions of psychedelic use by humans, namely by the Spanish conquistadors who observed the Aztecs and some of the mushroom ceremonies that were being done then. And then various other documentations of psychedelic use or knowledge in the subsequent centuries. Well, when we go forward a little bit further, we have this golden age of psychedelic research. Essentially, LSD is synthesized by Albert Hofmann in 1938, the famous Bicycle Day of 1943. If you haven't read about that, that's something interesting. You should kind of Google that and read that. Essentially, Albert Hofmann took LSD at that time and then got on his bicycle, rode around Amsterdam, eventually ended up in his house, but wrote about this in quite a lot of detail. And this is the first known purposeful LSD trip that was ever recorded. Quite insightful. But in that period of time, a lot of work was being done in the area of psychedelics. So a lot of work was being done with LSD and alcoholism and other psychedelics in terms of therapeutic use, specifically in the LSD arena, so much so that there was this plethora of research that really exploded out of the 1950s and the 1960s. Now we move forward, and the 1960s into the 1970s becomes an increasingly difficult time. There's a shift in culture. Again, a really fascinating history to dig into and read about, but essentially culminates in 1970 with this shift in culture and Richard Nixon declaring the war on drugs, which basically took all psychedelic substances, made them Schedule 1, which means no medical benefit, and they were made illegal. So this really shifted all that knowledge that was generated in the 50s and 60s and kind of pushed it underground, where therapists and other individuals who recognized the medical value of these substances continued to utilize them and utilize them to help people. And that's really this underground era that evolves. But in 1986, Rick Doblin founds this organization called MAPS, the Multidisciplinary Association for Psychedelic Studies. And in doing so, he creates a roadmap to try to attempt to have psychedelics FDA approved. And he utilized a roadmap with MDMA to get there eventually, and culminating to the present day, we have completion of 2 phase 3 trials, and MDMA perhaps will be legal in this year, or at least the early next year. So some important stuff was happening at that point in time underground, and then we move forward, and there's this turning point that seems to occur in the 90s. There's information about psychedelics starts to be uncovered. We start to look at the mechanism of some of these substances and how they work. We start to elucidate the receptors that they work on. And this culminates in 2006 with Dr. Griffiths publishing his landmark paper on psilocybin. And really in this period of time, it kind of thrust psychedelics back into the academic spotlight. And so much so that the early 2010s, we have this renewal of psychedelic academic research. And some people have coined this the psychedelic renaissance. And here we have more imaging studies being done and some more clinical research being done, so much so that in 2017, the FDA designates MDMA as breakthrough therapy for PTSD, and also psilocybin for breakthrough treatment in terms of depression. That happened in 2018, and also that was the release of Michael Pollan's famous book, How to Change Your Mind, which is now a Netflix documentary in 4 episodes. And this really continues to engage the public in the possibility of psychedelics. In Canada, we get some positive movement forward in 2020. Patty Hajdu, the health minister at that time, made an exemption for 4 Canadians to access psilocybin who are suffering from terminal cancer. We have more movement from positive studies clinically. And finally, in January 2022, Canada creates an amendment to what is called the Special Access Program, and now patients can access psilocybin and MDMA through this specialized program if a doctor makes an application to the program for them to receive it. So really, there's this social change underfoot occurring in some countries, and we can see the evidence of this happening and evolving in other countries as well. So a real story timeline of history in the history of psychedelics. Really important to understand this is not something that has just evolved in the last decade or two. This has a really significant history that is important to learn about in order to really understand psychedelics and how they've got to the place where they are today, and how the research is representative of a lot of the clinical and all changes and information that we are hearing in our media on a day-to-day. Okay, so what exactly are psychedelics? Well, the word itself is an interesting one, and it means mind manifesting. And this was coined by Humphrey Osmond. Humphrey Osmond was a researcher that was actually working in Saskatchewan and in Canada in the 1950s. And he was part of a program at the Weyburn Mental Health Hospital, where he was conducting work with LSD and alcoholism with some interesting results. And him and Aldous Huxley, who wrote The Doors of Perception, were pen pals, and they were writing back and forth to each other. And at one point, Humphrey Osmond said, when they were trying to figure out, a name for these things or what to call them, he wrote and said, "To fathom hell or soar angelic, just take a pinch of psychedelic." And that was the birth of the word psychedelic, which means mind manifesting, and comes from psyche and delon, which means, again, specifically mind, and to manifest from the Greek. How do we kind of describe these drugs or these medicines? Well, what they do primarily is they alter our conscious experience. And that's an alteration of our perception, an alteration of our mood and our cognition. And if you stare at this kind of image I put up here and stare at it closely, it should be moving, all right? Or maybe maybe it's not moving for you, but if you look long enough, you probably see some movement in there. That image is actually not moving. That's your brain that's kind of seeing that as moving. And if you have some understanding of that, then you probably have a good and deep understanding of what psychedelics are. So stay tuned for that in the second talk of this series, as I mentioned at the very beginning. All right, well, how do we group and classify psychedelics? That's really important to organize these things and see kind of where all of the psychedelic medicines sit. So this is one way to look at this, okay? You've got your hallucinogens. Hallucinogens are a class of molecules that are made up of the classical psychedelics. The classical psychedelics are psilocybin, LSD, mescaline, and DMT. They all get grouped under a category of classical psychedelics because they all act with a similar mechanism. On the other side, you have your atypical psychedelics. Well, you have your empathogens. Your empathogens are molecules like MDMA. You have your dissociative agents. Those are molecules like ketamine, okay? Phencyclidine is also there as well, which is PCP, but ketamine, again, one of the medicines that we're using currently in the treatment in the psychedelic-assisted therapy realm. And then you have other atypical psychedelics with various mechanisms, and cannabis is actually under there. So cannabis has very mild psychedelic properties. A lot of people don't know that, but specifically THC, which means, again, remember, it's just the alteration of our ordinary state of consciousness. So an alteration of perception, of mood, right? Cannabis does this, and it does it to a mild effect. So that really is a sense to give everybody an idea of where these molecules sit and how we kind of coordinate and organize them. Okay. Important to give some time to this. So again, this is something that I'll go into more detail in the next talk that I give, but it's kind of, to get a sense of what's happening in the brain with psychedelics is critically important to really understand how there's any potential that these medicines could be used in therapy. So let's roll through this, okay? The first concept is to think about your brain and what it is. So your brain is nested within this skull. It has no access to the outside world on its own. It does through our various senses, like our eyes and our ears and our tongue and all of our body and the touch receptors in our body. And all of these senses are constantly giving information to our brain. And our brain is taking in all that information and recording it and tabulating it and trying to make sense of it and testing if that information coming in is actually what it believes to be out there in the world. So it's this little scientist, and it's trying to make all these predictions all the time about what's out there, given all the information it learns coming in. Okay, so that's kind of like a high level concept. Let's look at this a little bit in detail. All right, well, look at this screen right here, okay? And you've got this rock slab, it looks like in the middle of a field, and it looks like it's two different colors. So the question is that two different colors? Well, the other feature of this is that it appears that there is a light overhead shining a light on this feature and giving the idea of a shadow. Our brain understands shadows really well. It's exposed to shadows almost immediately from when it comes into the world. So in order to understand how things appear and where they are, our brain uses shadow. And all you have to do is eliminate the concept that these things might be bent and might be in shadow like that, and all of a sudden the colors stay the same. Now I'll take it away from you and show you that the colors difference and the colors return. So our brain is coloring in this object based on its concepts and ideas and knowledge and experience of shadows. It's making a prediction. So that little scientist in the box is sampling this and making a prediction about what is actually there. I'll do it again. There you go. If you think we're I'm kind of tricking you here with some slide, sleight of hand of slides, I'll do it really slow, and as we slowly blur out that concept of the shadow, the two rocks become the same color, and there you go, and we'll make that reappear. Okay, if that was hard, maybe you didn't see it so clearly, maybe it's started to see like that was all the same color. Let's try this one. Take a look at this, take a few seconds, stare at this. What do you have here? Looks like a slate of different colors. There are different contrasts. There's some dark black ones, there's some lighter gray ones, mixes of shades of gray and some white. Is there anything there? Right? Well, watch this. If I just do this really fast, there you go, there you go. Okay. Now try to not see that cow. Pause the video, it takes some time. Try to not see that cow. Now nothing changed whatsoever. Right? In that picture. When I showed you that picture originally, it was the same blotches of different contrasts of different colors there. Nothing else changed. All I did was outline the semblance of what we understand and know as cows, and now your brain is seeing that cow. It's predicting that there is a cow there, no matter how hard you try not to predict that that's there. And this is how our brain works. Our brain is constantly making predictions about the environment and ensuring that what's coming back matches our predictions. So your brain is the master predictor, the master scientist in a box. Okay, that's how our brain works normally and allows us to function. And a healthy balance of all these predictions allows you to be in the world as you are. Okay, so what if you got into a state, or your brain got into a state, where it was over predicting? That ability to make those predictions was too strong. Could our predictions be harmful to us at that point in time? That's the question to ask. Let's see. Okay, what's really important is for all of you to have some idea about what is happening to the brain as it develops over time. How does it go from the baby brain into this brain that is able to predict its environment and be that master scientist I described? Well, let's start with the young, undeveloped brain. As a pediatric neurologist, we learn a lot about brain development, and I think having had that background has really allowed me to understand what's happening with psychedelics, so hopefully I can relay that to all of you here. So this picture is trying to depict the undeveloped brain. This is a brain of really high potential. Okay? This is the baby brain. The baby brain is the learning brain. It has really no ability or very limited ability to make good predictions. Well, because it doesn't have a good data set. It hasn't been around in the world that long. It hasn't taken in a lot of the external environment. So it is in a position in which it has to learn these things. So this is a very free brain. It's very unconstrained. There are lots of connections throughout this brain because it's just taking in as much information as possible. And what it has to do with that information is start to develop predictions and make sure that its predictions are accurate. And after it does this over many, many, many years, you end up evolving the brain into the mature brain, the adult brain. And as you can see, I've tried to depict here in this graphic a brain that is somewhat constrained. Okay, it has its network built in, but it still has an appropriate number of connections such that it allows for flexibility to some degree to modify these predictions, to update these predictions, to make new predictions. So it's a nicely balanced brain, and its prediction ability is appropriate at this time. And what we know about the connections here is that there's some major connections which are established, but then there's this ability to access some of the more minor connections for that flexibility, right? So major connections, for instance, we just saw in the previous example is like seeing faces in things. That seems to be a real strong predictive ability and an important one for humans. As you're born a little baby, you've got to be able to recognize faces of other humans really early, faces of your predators really early. So those things are kind of very strongly established. Now, for many different reasons, your brain can kind of move into this state of over prediction. Or another way to think about this is that you just have a very sensitive ability to make predictions. And then the more you make them, you actually might run into a state in which those predictions become harmful. Why would that be the case? Well, if you get to that state, you might make your brain too rigid. So I call this the rigid brain. And some examples of this are states of depression, states of high anxiety. We even see this after concussions and brain injuries. And I call this the stuck brain. Why? Well, its prediction ability is extremely high. It's very constrained in its way and has a low number of really strong connections. And this brain kind of doesn't have the flexibility to move beyond what it already believes to be the way of the world or what it believes to be affecting it. So an example might be in depression, how some individuals get into ruminating states where they're thinking over and over and over again of negative feelings and thoughts that get reinforced. Well, it's really hard to break out of that. And this is what we call the rigid brain. Okay, so what is it exactly that psychedelics are doing to the brain? What is its action? Well, psychedelics, and we'll see this in the future talk, have very specific actions in the brain. And as a whole, what they do is they activate a system that relaxes these networks in the brain. So the way to kind of conceptualize or look at this, you know, from a picture point of view is this image here, where I'm showing the network kind of loosening. That tight net that is encompassing the brain is loosened and temporarily relaxed. And this is the psychedelic brain. So its prediction ability actually becomes really low because relaxing on that network causes a relaxation of predictions or a loosening of predictions or an ability to make those predictions. And what happens is this constrained state gets lifted, and now the individual has the potential to access all those minor connections which were not being accessed before. And that happens temporarily. Now, as the brain kind of rebuilds back up its network as the psychedelic effect wears off, well, what might happen is the re-networking of the brain. And so we've taken this previous rigid brain state, we've loosened the network or relaxed the network, rebuilt that network back up. So this brain is slightly more loose. Its prediction ability has gone up a little bit now. It's not so constrained and stuck, and its connections have kind of increased. And this, to some degree, is the model that I want you to conceptualize about what is happening under psychedelics. Now, we have some evidence to show that this is actually happening. So this is a study that looked at individuals and exposed their brains to ketamine. So this is the baseline. To kind of understand right here what's happening is if you look at the different colors and you look at the diagram here, kind of the lack of the higher colors, red and yellow and stuff, the more green here, that's talking a little bit about how well connected that brain is. It's a marker for brain connections, right? Now, 24 hours post-ketamine, you see this brain kind of light up all over the place and the outside here in that cortex area. And that is an indirect measure that this brain is more connected than it was prior to the exposure to ketamine. We also see this with psilocybin. This is a very famous picture that was developed in 2014 and shows a difference between placebo and psilocybin given to the same individuals 14 days apart. And under the influence of psilocybin, when you put these people into a functional magnetic resonance imaging scanner, an fMRI, there is evidence of more interconnectedness within the brain. So it's really important seeing some of the brain mechanisms of psychedelics and giving you a model there to kind of compare these to what's going on with our current and traditional antidepressant drugs. Now, the antidepressant drugs like the SSRIs, SNRIs, so these are the daily use medications that are out there. These drugs have a really important role. Okay? But they work differently. They ultimately, in some people, do result in improved depression levels and improved levels of well-being, but they kind of do it from another route. So what they do is they work on a different part of the brain than psychedelics do, and they tend to decrease how we respond to emotion. So emotion's not as strong, feelings are not as strong. Some of the downside of this is that people actually complain about that on these medications they're actually not feeling much. And if you're not feeling much, you're less likely to explore why you're getting those feelings in the first place. So really important, if you're bombarded by a lot of negative and challenging circumstances, you might need a medication at a time just to put the brakes on that so you can kind of go off and take care of your family, take care of your kids, focus at school, and that's okay for that time, and sometimes we need them. This is a tool in our toolkit, and it should be used accordingly. The problem with this is we know that a vast majority of people actually either lose the effects of this or their depression doesn't actually respond to this. And it might be because just blocking the emotions is not actually the route at which is required for that person to get better. On the other side, psychedelics, as I said, they work in a different way in the brain. And what they do is they don't really kind of push our emotions away or make us less responsive to them. They actually increase our responsiveness. And by virtue of increasing responsiveness to your thoughts and feelings and challenging histories and whatnot, it might actually allow somebody to start to process those difficulties and start to integrate those difficulties. So they too lead to improvements in depression, improvements in well-being, but psychedelics are doing it from a different mechanism. So these are both two important medicines, and they have two important roles, and it's important to understand that such that one can utilize these tools in a proper way in a given circumstance. So really what you have is this differential action but similar outcome from both these medicines. Okay, so which psychedelics are available? This is going to be a little bit Canada-centric. I'm a Canadian neurologist, so we're going to hear from the Canadian side. There are various different psychedelics available or not available in different means in different countries. So if you have questions about that, for sure, just put them in the comments, and I'll try to get to them and see if I can answer those. So in Canada, what's available right now is psilocybin and MDMA, but that is only through the Special Access Program or a Section 56 exemption. So you have to have specific permission to access those. And again, that's for treating very serious or difficult medical situations. Ketamine, on the other hand, is available. It is indicated for depression, and given that it's available as a drug that we can prescribe, it's available from various different uses. Okay, so going through these one by one, first we have psilocybin. What is psilocybin? It's a molecule. It's produced by more than 200 different species of fungi. It kind of peaks at about a 40 to 60 minute time, lasts about 2 to 6 hours. Mentioned the FDA status here before, and it is illegal in Canada, but available through the Special Access Program as mentioned. Some highlights for psilocybin in clinical trials. So it's shown good, generally positive results to be safe and tolerable. Main highlights are in depression. So many studies are emerging about psilocybin's positive effects in depression and other situations as well, as you can read up there. And so a little bit of a wide variety of effects for psilocybin right now, lots to be uncovered lots to learn about. Then we have MDMA. It's an pathogen classified previously, and it's the molecule, one of the molecules that brings forth states of empathy. Interestingly, it was actually synthesized in 1912 by Merck. They were looking for compounds that cause blood clotting or stop bleeding. MDMA didn't do that, so never went forward in that sense from there. But then in the 60s and 70s, famous chemist Alexander Shulgin, he did synthesize MDMA and a bunch of other related compounds and kind of introduced that to psychotherapists at the time, who went on to utilize MDMA in therapy throughout the 70s. MDMA, really interesting history, one to look into. It actually peaks at about 60 to 90 minutes, lasts about 4 to 6 hours. As mentioned, the FDA designated that breakthrough therapy in 2017 for the treatment of PTSD. It is illegal still and is accessible in Canada through the Special Access Program. Now, positive results for MDMA, the big highlight is PTSD. The phase 3 study has been complete. One having been completed over a year ago now, I believe, and the other confirmatory phase 3 results were just released in the last few months. So MDMA is going to application to the FDA for approval. So we will likely see MDMA approved for the treatment of PTSD in 2023, at least by the end of 2023, if not early 2024. So really distinct and important results for the treatment of PTSD, especially treatment-resistant PTSD, utilizing MDMA-assisted therapy. So stay tuned for that. Big shifts coming in the near future. Ketamine has also a really fascinating history. Synthesized in 1962, it has been used as a component of anesthesia for some time. If you've had surgery and had general anesthesia, you've likely been exposed to ketamine. In the early 2000s, late 90s, some work was being done. In early 2000, it was discovered as a treatment for depression in doses that are much lower than what's used in anesthesia. So it has many off-label uses now. It's being used in various different mental health conditions. All right, many different formulations. There's an oral, nasal, IV, and intramuscular injected forms. It's illegal recreationally, but from a medical status point of view, it's, as I mentioned, an anesthetic agent, and the FDA has approval for a particular type of spray, ketamine spray, that's used for treatment-resistant depression, and that was approved in 2019. Clinical trials for ketamine, a lot of clinical trials out there, positive results, seems to be very safe and tolerable. One of the highlights is alcohol use. It's actually going into a phase 3 study for the use of alcohol use disorder. So some of the highlights here, one study showed that after 3 sessions, the participants who were really complex alcoholics, there was an 86% abstinence rate compared to 2% pre-trial and 162 out of 180 days of abstinence in the cohort. I think it was almost close to 100 patients or 100 individuals in that study. So quite robust numbers that are moving into phase 3. All right, so here where it's really important to understand how psychedelics are used, okay? And this is in the context of what's called psychedelic-assisted therapy. So this is the medical model of psychedelics, and it really is a fresh perspective on what we might be used to in our more traditional Western medical model. Okay, so what psychedelic-assisted therapy does is it utilizes the psychedelic substance as a catalyst with an integrative therapy approach. What does that mean? That means someone comes to the therapist and given the issues that they have at hand, the therapist with their set of expertise utilizes different types of psychotherapy in order to achieve certain targets and goals, and the psychedelics are used as a catalyst to help promote the therapy. Now, what the psychedelic medicine does, is it generates what's called context-specific insights. So again, remember, it's loosening that predictive ability on the brain. So when one is in therapy under the influence of psychedelic, these big insights will come up. And normally this is what happens in therapy, but under the influence of the psychedelic, these insights are generated in a much stronger and a much faster way than one in comparison to one who might be in therapy for years before any significant big insights are generated. So this is really the way in which we have to conceptualize how psychedelics are used. It's not that traditional way of our antidepressants, take this and take it every single day and let's see how you feel in 3 months. It's very much an interactive type of model with the treating practitioner, and one in which we are utilizing therapy in addition to the medicine. So what's the general framework for psychedelic-assisted psychotherapy? Well, first is the intake process. That's really important, being sure you're medically and psychologically appropriate to undergo psychedelic therapy. Next is the preparation. That's when one will meet with a certain therapist, go over some of the intentions for undergoing psychedelic therapy, what are some of the techniques to support the person before, during, and after. And then subsequent to that is the treatment, as we discussed, utilizing the psychedelic with the psychotherapist and generating those context-specific insights. And then the most important piece, in my opinion, being the follow-up piece, that integration piece. Like, what are we actually doing with the insights that get generated? What kind of change are we going to be focusing on making? I like a saying that I put together in this context to say that inaction is the deathbed of insight. So no matter what insights one can generate and come up with, if you don't do anything about them, what real change is going to happen at that point in time? And that's why it is so important, in my opinion, for psychedelics and psychedelic therapies to be utilized in the context of good psychotherapy. So how does this apply to neurology? Where can we use psychedelics within the context of neurology? So really important area of study, my passion and interest in trying to determine exactly how we're going to use these really powerful medicines in the context of neurology. So the first very obvious area for me as a neurologist is just looking at the associated mental health challenges that come with neurologic disease. We know this statistically. First off, there are numerous people in the world suffering from neurologic disorders and neurologic disease. Statistically, when we examine mental health conditions in the context of neurologic disease, we have very high prevalence rate. In this one study, 55% prevalence of mental health conditions in the context of neurologic disease. And in a subsequent study that looked, or a different study that looked at how neurologic disease persists over time, they had patients come in and then assess them months later. And 8 months later, people who claim that they were depressed or had a diagnosis of depression continued to be depressed despite treatment. And so this is a real critical area in the context of neurology. And knowing that psychedelics have some good evidence in mental health conditions, the question is, can people with these underlying neurologic diseases and conditions, can they undergo psychedelic-assisted therapy? And we really need the neurologists in this case to come forward as experts to learn about these things in order to ensure our psychology and our psychiatry and our psychotherapy colleagues and others in the space that people with underlying neurologic disease are safe, or to define the risks that might occur if they were to undergo psychedelic treatments. And again, this is why we need the neurologists here. So an obvious area of need right here. Going forward, what's the future? Well, there are applications for psychedelics from a really clear and evolving neurobiologic basis in the context of functional neurological disorders, in the context of headache and migraine headache. Cluster headache already has some evidence. Migraine also has some evidence with psilocybin that's emerging. And then brain injury, especially post-concussion syndrome, or what used to be known as post-concussion syndrome, which is now known as persistent post-concussive symptoms. That this, to me, and the data is showing this, is a condition in which the brain is in a state of overprediction. And we've already shown how psychedelics kind of relax those predictions. So could that be used in a post-concussion state? It's time will tell. Evidence will come forward. And this is these three areas are a strong area of interest for me at my clinic, and the area that we're working on to explore from a research and from a clinical point of view. So what's available today? What's out there for everybody? Well, again, being a bit Canadian-centric, we've got some Canadian places where you can visit to be treated. We have some places in the U.S. as well where there are clinical trials being done, and regulations are starting to relax a little bit around psychedelic therapy, so making them more and more accessible. From community support, there's lots of great community support organizations out there. We've got some in Canada. There are others outside of Canada as well. Here's a few that are important to look into if you're looking for any advice or looking for any information about psychedelic therapies or psychedelics in general. At my particular clinic at Neurology Center Toronto by Numinous, we are offering treatment to those with and without neurologic disorders. Really important to know that some of this is funded by the government right now, some of the medical elements of it. The other components that are in terms of the therapy and whatnot are not funded. But here's a variety of services that we're offering that you can see here. Now, what conditions are we exploring at our clinic and are we assessing patients for? There's a list of them there. I've mentioned a lot of these already. Some of the more primary mental health conditions like anxiety disorders and PTSD, OCD, eating disorders, depression are also included amongst the neurology type disorders that we're exploring. Our team here is very rehabilitation oriented. What does that mean? We're not very interested in bringing patients in, treating with psychedelics and saying goodbye. We're more interested in the A to Z of individuals. We realize that psychedelics and ketamine, despite having a lot of promise, they're just a tool in our toolkit. We have enough experience under our belts here to understand that our patients, they require more than a single medical treatment. There's a lot of other things at play, and that's why our team is so varied. Our team consists of physicians and mental health practitioners, nurses, physician assistants, and we also have a great allied health team, occupational therapists, physiotherapists as well to help support individuals. Again, very much from a rehabilitation lens rather than a medical oriented or a treatment lens. This is what the program looks like to give a sense of how we are providing that type of rehabilitation-oriented care, just to show everybody what a pathway might look like at a clinic in terms of psychedelic therapy, but I think ours is pretty unique. So this is our ketamine-assisted therapy program at NCT. You come through and education. There's a lot of education up front. I'm hoping this talk will serve as education for those coming into the program, but also as well to the general public. But we also have very specific education sessions with our nurse that all patients have up front. Then there's that intake screening process, as I mentioned before. Look at my pointer out here to show where we're at. We're over here. Okay, so this is the intake process. We have a medical intake and a therapy assessment. This therapy assessment is really to define the diagnosis. What psychological areas and issues are you bringing forward? And if so, what do we want to target? This makes our program unique, I believe. We have a multidisciplinary meeting every week. What does that mean? We call it our Ketamine-Assisted Therapy Conference, where the whole team gets together and describes every single patient's case. And we come up with a very concerted treatment plan. And that treatment plan might imply ketamine, right? It might imply other modalities. It might imply certain other medicines that are required. It might imply certain other therapies that are required. As I mentioned before, it might be that you need an occupational therapist to help return to work after we work through some of the challenging issues through the ketamine program, as an example. And a nice little piece there is that the individual's diagnosis, which is established in the intake assessment, is reviewed separately by head of our psychology and part of the program to really ensure we have the right diagnosis going in. At this point in time, the team makes a decision. It might be that you're not amenable to ketamine treatment. There might be safety issues. There might be indeterminacy in diagnosis. There might be other reasons why ketamine at that moment is not a good choice for you. We're going to be very honest with patients, and we're going to make sure patients are getting the right treatment. Those that are amenable enter the treatment phase. The treatment phase consists of some preparatory sessions. We've seen this in the general framework. There's updates with our nurse and our physicians, and then 3 treatment sessions is kind of standard. There might be more treatment sessions, there might be less. Every treatment session follows with an integration session with the therapist. The nurse checks in, and then 1 week later is the next session, and then 1 week later would be the next session, and then potentially 1 week later if there are more sessions thereafter. If 3 sessions is enough, or however many sessions is enough. There are some closing medical and therapy sessions, and then the most important part, as I mentioned before, the integration and the ongoing care. This is our ketamine treatment room. This is kind of what it looks like. This is our room 1. We're building out some more rooms. Okay, and then last, I really do like this quote by Stanislav Grof, who said, "Psychedelics used responsibly with proper caution would be for psychiatry what the microscope is for biology or the telescope for astronomy." Such a great quote, letting us know that there is great insight to be gleaned from psychedelics. I like to kind of twist this a little bit and add that neurology piece to it, because I do believe the same for neurology, and building on the backs of famous individuals like this gentleman here, Sigmund Freud, who originally was a neurologist, and Oliver Sacks as well, provide a lot of insight into neurologic disease and the philosophy underlying a lot of our perceptions and consciousness. So I do believe psychedelics is really going to offer that lens into understanding the brain better, and in doing so, we'll be able to move forward and provide treatments for others in a more effective. Okay, so thanks. I hope that that was a helpful, kind of real high level run through of psychedelics. There's just so much content to cover. It really is hard to cover in a reasonable amount of time. If you like this, stay tuned for the next presentation, which is going to be on brain mechanisms and digging into some more very specific details about how psychedelics work in the brain. If you're interested to learn more, that QR code right there will take you to our website where you can learn more. And this QR code over here will have all the list of sources I used to put this talk together, and some of the ones in the future as well. That will take you to my website with the library. I'm constantly building that up. So if you have any requests for any type of resources or sources, then just leave me in the comments and I'll try to get to that. All right, everyone. Again, thanks very much, and hope this was helpful, and we'll see you at the next talk.